signing it. That's your official document.
And then do what?
Then you hand it over to us. After that, it's not...
The CDC, I know with Trump becoming a president in America, we have a lot of issues. But now we've been following on media the health of Dr. Kiiza Besigye. So there are very many contradicting statements in the media and out there. So we wanted to know the state of his health and how you're managing him if he's not well, so that the public and the population can know really what is happening. Because even us here, we've been in the villages, we don't know what's happening. But when we see such on the media, we have to also raise that concern. Thank you. And how you're managing him if he's not well, so that the public and the population can know really what is happening. Because even us here, we've been in the villages, we don't know what's happening. But when we see such on the media, we have to also raise that concern. Thank you.
Mr. Chairman, Honorable Chairman, since the Commissioner General is here, let him answer for himself. Me, I'm not a doctor. If I was to inject you, I would send you to your creator.
And I don't think we would take it lightly with the officers concerned with that. Two, on the issue of the construction of the mini-max prisons. We have a strategic plan for those mini-max prisons. And the construction, we are going to phase them out. One, we shall have one fund permitting. We are going to start with Mbarara mini-max, which we are going to construct. Then in Northern, we are going to have one in Lugore, because we look at where the areas with the big pieces of land. So another one will be in Mbarara. The first phase is going to be in Mbarara. Second one, and the third and the fourth, Gulu, Soroti, and Fort Poto. Because that is the way to go, that in a one place we can contain all this. Now, on the issue of Dr. Kiiza Besigye accessing his personal doctors. There's been a lot of misinformation, but the truth is that we are taking care of Dr. Kiiza Besigye to the best of our, but of course he has his preference, and together with the family and considering all other issues at hand, when need arises, he can be able to allow to access his personal doctor. But otherwise, prisons have the capacity to handle. But as and when need arises, he's allowed to have access to his personal doctor.
Okay.
Yeah. Yes, Wamani.
Yeah. Maybe it's also worth to note that when he's allowed to have his personal doctors, they still have to work together with our doctors.
With the prison's doctors?
Yes.
Okay. Now, two issues, and then we let you...
Honourable members, I would like you to note that the Ministry will increasing the focus on improving access to justice for all, improvement of staff welfare, improvement of infrastructure, housing, and staff through a holistic approach to solve the staff accommodation problems in UPF, UPC, UPS, and DCIC, using private-public partnership arrangements. The details will be reflected in the respective MP presentations by the accounting, MPS presentations by the accounting officer. I would like to note, Mr. Chairman, that the housing situation for the police, immigration, and prisons is shameful, to say the least. Very, very, very disturbing. I thank you. Thank you for listening.